Today, the presentation I'll be going over is hand washing practices among emergency medical service providers. Table of contents, we will go over the theorist we are discussing in our article and the research, the theory, the problem, relevant research, research study, results, discussion, limitations, conclusions, and reference. The research article is about hand hygiene and the emergency service providers. The article we chose is hand washing practices among emergency medical service. We will look at it from Florence Nightingale's environment theory. And why is this so important? Florence Nightingale was born in 1820 in Florence, Italy. She had a divine calling to practice God's work and help others. She helped establish nursing as a profession. She started the environmental theory in nursing, and hospitals were unclean at the time. The environmental theory focuses on the environment. 4 major concepts are in this. The environment, which includes house, bedding cleanliness, personal cleanliness, food intake, and observation of the sick person, the individual who receives the nursing care, health, be able to use the power one has and that nature heals, and nurse, carry out things in the environment and apply nursing process. So what's the problem with poor hand hygiene? No healthcare facility is immune to hand washing issues. Hand hygiene is encouraged before and after walking into every patient room or touching any patient. The lack of hand hygiene compliance results in transmission of community-acquired and hospital-acquired microorganisms between both patients and providers. So the availability of hand hygiene, this would include that most hospitals have foam, gel, or sinks outside of each patient room for personnel to use. Hand hygiene is still high for those who are compliant, but the assumption is that it is an employee problem or bad habit when they do not use proper hand hygiene. Ancillary staff also are non-compliant. The study looked at just pre-hospital staff not being compliant, but ancillary staff can also be as bad at not washing their hands. How does this relate to the theory? The study looks at clean environments, which is under environment of the theory of Florence Nightingale. The study further mentions EMS staff interacting with patients in their home and where cleanliness is questionable. The lack of hand hygiene in EMS is higher than hospital staff. And the reason this is so important is hand hygiene, if it's poor, they can prevent or they can spread germs to others. If you use proper hand hygiene, it'll prevent the spread of germs. So the introduction to our study and theory. Healthcare workers' compliance with hand hygiene remains a pervasive problem in medicine. While poor hand hygiene is prevalent in the hospital, these behaviors may also be similar among pre-hospital providers. Emergency medical staff frequently come into contact with patients in their homes or other social environments. The study was conducted in 2011. It identified that patients who were treated and transported by advanced life support paramedics, which is a type of CPR, had a higher rate of nosocomial infection than patients not transported by ALS providers. What is the rate of hand hygiene among EMS personnel in various clinical conditions is what we must ask ourselves next. So hand hygiene practices among emergency medical service providers. The methods used in this study, the author of the study designed a survey about hand hygiene practices. The survey was distributed through national EMS organizations through email. The survey was filled out by EMS professionals on a voluntary basis. So continuing on with the methods, the questionnaire was emailed to National Organization of Emergency Medical Service. Participants were voluntary and they were unsupervised while filling out the survey. They rated themselves as poor with hand hygiene, and all services provided hand hygiene equipment, which includes gloves and sanitizer. So there should be really no question to why people are non-compliant. And here are the results of their survey they did. They had a total of 1,494 survey respondents. There were more males, 72%, and 28 of females. And you can see here, these are their various ages, the most being young, from 18 to 29. So here are the results continued, and you can just look at this graph that talks about client cleans before patient, cleans after skin contact, cleans with contact finishes, uses gloves, or uses gloves with equipment. And this table is continued, cleans after using equipment, cleans after driving an ambulance, cleans after invasive procedure, and cleans a stethoscope. So the survey went into more than just asking, did you wash your hands or not? The results also go on to say that a study showed that women are more compliant than men with hand hygiene. More women brought their own sanitizer on the job. Women cleaned equipment more than men did, and women also cleaned personal equipment, which includes their stethoscope, more than men. And they also tend to wear gloves more than men. The results also showed women reported cleaning their hands significantly more than men. An increased respondent age also showed higher likelihood of reporting hand hygiene. So it seems to be if they were in the field longer, then they are better at washing their hands. The level of experience did not provide clear relationship regarding hand hygiene, and EMS physicians reported cleaning their hands significantly more than most other physician groups. The results continued. Presence of hand sanitizer in the ambulance did not make a difference in hand hygiene. Providers that brought their own sanitizer were more likely to use them. Presence of hand sanitizer in the ambulance bays significantly increased compliance. So we want to discuss what this study shows. It was the largest study to date of EMS personnel and hand hygiene. Historically, compliance among EMS was low and still remains a concern since they're the first line to the patient. The study finds that women are more likely to clean their hands, and older EMS personnel are responsible to more likely clean their hands. Continuing on with the discussion, compliance in situations involving invasive procedures is only 33% overall. Only 13% reported cleaning their hands before patient contact. Only 13% reported to cleaning their hands, their stethoscope. And this study was conducted by Merlin, found significant number of paramedic stethoscopes were colonized with MRSA. And only 52% of respondents reported that they wear gloves with every patient contact. As you can see, this is a concern overall because it's less than half of people are using proper hand hygiene with anything, and to show that their equipment is colonizing infections that can be spread to others, and they're very hard to treat. Some of the limitations of this study. The study was done as a voluntary survey, and therefore the results might have been skewed. So someone could have lied probably about it. No direct observation of hand hygiene was done due to the cost. So this was just an easy way to get the opinion of others. Results of the survey were anonymous, but participants with personal interest could have skewed the results. And response rate was not able to be calculated due to the email method of distribution they used. In conclusion, hand hygiene in healthcare environment remains a concern. Emergency medical services operates in pre-hospital non-sterile environment. EMS personnel should strive to deliver best care possible without contamination and transmission of disease, and more education and enforcement is needed on the subject of hand hygiene. And here are our references. Thank you for listening to me today.